so that we have it recorded, so that we have that for folks that are just joining us as we get started. So let's go ahead now that it is 11 and get started. So greetings and welcome to Understanding PASSR with Telegen. Today is part 2. We are going to cover 3 things today. We're going to be presenting on the background and overview of PASSR process to level set for everybody. We're going to discuss requirements and process steps specific to the level 1 screen and then do the demo. And we want to provide you some slides for the overview of the level 2 process as well. So that'll mostly be in the slide deck you'll get later. Background and overview. So first up, let's talk about the whole picture of PASSR to make sure, again, we're all staying grounded in why we're doing this. So when discussing the history of PASSR, it's important to start with why PASSR was created. PASSR stands for the Pre-Admission Screening and Resident Review. It was created in 1987, so over 30 years ago, at the national level through CMS as a way to address the institutionalization of individuals with disabilities, primarily mental health or intellectual developmental disabilities. Before PASSR, there were too often inappropriate placements in restrictive environments, inadequate assessments and care plans relating to mental health or IDD needs. There was inadequate provision of specialized services to address those unique needs, and discrimination was happening based on this disability. Now, because of the purpose and goals of PASSR, all applicants to any nursing facility licensed to accept Medicaid, regardless of their individual funding, must be screened through PASSR. This screening is looking for one key element only. Is there a known or suspected PASSR condition? Then, if so, there's an independent and objective person-centered evaluation offered to make 3 recommendations. 1, is there a presence of a PASSR condition? 2, is the nursing home the most appropriate level of care? And 3, assuring the receipt of needed services. There's a lot of great information about the long life and evolution of the PASSR program over the last 30 years, including the current notice of proposed rulemaking that just came out last year. All of this is available through the PASSR Technical Assistance page at passrassist.org. You can see the website here on the slide, and you will get a copy of this. This website is full of free resources from CMS that are dedicated to helping states implement and succeed at PASSR. Telegen, as an organization, leverages PTAC's resources and their information to help guide us on the history and the best practices. Stay aligned to national standards through each state has the freedom to implement specific regulations to fit their populations and landscapes. Knowing the why for PASSR is important to embracing the purpose beyond compliance and pushing paper, but to truly see the value of supporting individuals and their unique needs during a vulnerable life transition. So that's a little bit about the historical context for why. Now let's talk about the what. What is PASSR? What is this thing we've been talking about for a couple weeks? PASSR is made up of a 2-part process. Essentially, we've got the level 1 screen and we have the level 2 evaluation, which together have those 3 goals we've mentioned: detection of a potential diagnosis for a PASSR condition, verification of appropriate nursing home level of care, and determining the need for specialized services. But above all else, when we think about what PASSR is, the takeaway here is that this is a person-centered and strengths-based process. We'll talk a little bit more about what we mean by that from Telegen perspective, but it's also crucial to note that that PASSR is an objective process, not directly involving either the referral source or the nursing facility. PASSR is also working in partnership with the member to be supportive of their self-actualization, of their self-efficacy, and their self-empowerment. Meaning, for those of you that are familiar with motivational interviewing as a term, PASSR is very much in the MI spirit. PASSR is about promoting a full continuity of care from the nursing home, from the community, all the way up to the inpatient setting. And lastly, PASSR is about supporting the long-term goals of recovery and community engagement wherever possible. So now a bit more about what we mean when we say person-centered. What does Telligent mean by that buzzword? When we talk about operationalizing our PASSR program, we are looking to leverage an acronym that many of you may be familiar with called SNAP, which stands for creating an evaluation and planning process that is built on a foundation of the individual's own strengths, needs, abilities, and preferences, as defined by working with the individual. So, with that focus in mind, we've operationalized our entire PASSR process to be centered on the person, the individual, to see the individual as in charge and the expert of their own needs, to focus on optimizing the life satisfaction for the individual, and to help empower them to remove barriers, and that their results are defined by them, the people we are working on behalf of. We've also operationalized the entire PASSR process to focus on the opportunity to support the inherent worth and dignity of the individuals we are offered the chance to meet with and advocate for their own identified needs at this moment of vulnerable transition. Now that we've laid this foundation together for the why, let's talk about some of the definitions that are relevant to PASSR from a federal state standpoint so we know what our guideposts are and our boundaries are for this process. Okay. So, as we've noted, PASSR is focused on two types of conditions: mental illness and then intellectual developmental disability or related condition. These definitions are important as we continue this training for folks to be mindful of when completing the level one screen or getting a level two evaluation. As primarily the goals of PASSR are to create that accurate determination through screening for individuals that have a known or suspected PASSR condition. So we're going to start with the definition for intellectual developmental disability as defined by PASSR. Folks are not expected to commit these definitions to memory, but rather leverage this slide deck in the future or any of our other supporting documentation when completing your PASSR level one screen. So, all that said, the state of Colorado currently defines intellectual or developmental disability as significantly sub-average general intellectual functioning, existing concurrently with deficits in adaptive behavior and manifested during the developmental years. The concept of related condition is a part of PASSR as well, and it includes all of the above aspects for individuals who have a severe chronic disability attributable to cerebral palsy or epilepsy, for example, or any other condition other than mental illness. These related conditions result in an impairment of general intellectual functioning or adaptive behavior similar to that for individuals with an intellectual or developmental disability. They will require treatment or services similar to those for those other individuals. It should be noted that impairment of general intellectual functioning or adaptive behavior can only be determined in Colorado through the Community Center Board, the CCB, but the PASSR process can be completed concurrently. As we'll cover later, there's a contingent PASSR process that can be instituted while awaiting for a formal IDD determination. So that way we're not going to delay the admission or adoption of available specialized services outside those where the funding would only be tied to that formal IDD determination. The state's definition for mental illness is specific to a major mental disorder as defined as, example, primary diagnosis of schizophrenia, paranoia, delusional disorder, major affective disorder, schizoaffective disorder, or other psychosis. So note, this does not include the entirety of the DSM-5. Some of those notable exceptions would include neurocognitive disorder or having a primary diagnosis of dementia. Also having a non-primary diagnosis of dementia, as well as a non-primary diagnosis of a serious mental illness. Those are both exclusions. One helpful hint from PTAC is the second bullet here, which when you're thinking about mental illness meeting a PASSR condition, because again, it's not diagnosis equals PASSR condition, there's a little bit more nuance to it. The 3Ds are helpful to remember. You think about the duration of the illness, you think about the deficits that are caused in functioning areas, the distress called, or the distress resulting in someone's life, as well as knowing, again, that a dementia exclusion does exist as well. Just like the definitions of IDD and mental illness, the definition for what's considered specialized services is helpful to consider as well. So PASSR is focused on going above and beyond the great available nursing home services, such as OT, PT, leisure activities, and all those other great activities that are involved for all residents in a nursing home. We're including specific services that will enhance the quality of life for individuals identified as having a PASR condition that may not have otherwise been considered if not for this process. The goal for the level 2 evaluator is to recommend services that enhance the overall treatment plan and are created in partnership with the individual and the nursing facility to the maximum extent possible. And there are just some examples up here on the slide. So now that we have some background and definitions noted, let's cover this general process flow. So as we've been alluding to, PASSR has two parts. It has the screen, which is the doorway to the PASSR process, the level 1 screen, because the results of that screen will indicate who is referred for the level 2. So the screen is completed on 100% of admitting individuals to nursing facilities licensed to accept Medicaid, regardless of their payer source. The screen can be completed by staff referring an individual to a nursing facility through the single entry point program, the community center board for individuals residing in the community, or by hospital staff, or it can be done by folks with the hospital staff for folks admitting directly to the facility, or folks at the nursing home. Currently, as we all know, there is the 1135 waiver in effect relating to the national emergency declaration resulting from the pandemic, which has temporarily shifted the requirements for PASSR to be completed prior to admission by the referral source, so that rather they can be completed directly at the nursing facility up to 30 days post-admission. This training today is being provided with the knowledge that the intention of PASSR is to have the entire PASSR process completed prior to admission to ensure that the objective review of those three goals: is there a PASSR condition? Is the nursing home the most appropriate? And what special services could be recommended? We want all of that to be well known to the staff of the nursing facility day one, so that you have that knowledge as you look to work with that member. All that said, again, PASSR is a process that takes place whenever there's been a status change as well for the resident of a nursing home, regardless of the length of time they've been a resident and the timing of their last PASSR level 1 screen. Their last PASSR level 1 could have been 3 weeks ago, 3 months ago, or 3 years ago. If there's been a status change for the member, they've gotten different medications, they've had different, again, known or suspected PASSR behaviors, or new diagnoses added, or a time frame of a provisional admission has expired. For any of those reasons, you would be submitting another level 1. The level 2 evaluation is only completed on a subset of individuals. It tends to be about 20 or 30% of all level 1s would be eligible for a level 2. For folks that have triggered or have a known or suspected PASSR condition. Again, the purpose here is not to merely rubber stamp the paperwork and record of the individual, but to provide a comprehensive evaluation. And this evaluation will be done by a trained and appropriately credentialed individual. So let's talk a little bit about the level 1 requirements as we move on. The language in both the federal and Colorado regulation is clear. The role of the level 1 is to identify individuals with a known or suspected PASSR condition. The questions should be simple and straightforward so that they can be completed consistently by a wide variety of professionals across the state in a timely manner without much difficulty or burden. All the questions on the Tellergen level 1 form will be yes or no questions. I think there's 12 or 13 of them. The goal here is to focus not just on a current diagnoses or medications, though both of those questions do have utility, but really to raise critical thinking and curiosity and ask about current symptoms or other indicators that may not be part of the record as a diagnosis or medication only. The aim of the level 1 is to reduce to the maximum extent possible the occurrence of false positives and false negatives. A false positive is when the level 1 screen indicates that there's a likely PASSR condition, yet there's no finding of a PASSR condition when a level 2 is done upon further evaluation. And a false negative is when a level 1 screen misses the PASSR condition that is truly present. So this is a balance of efficiency and patient care. As a result of completing the yes no questions for the level one screen in qualatrack, the Telligent online portal, which we're going to demo today, there will be one of three outcomes. There'll be a no level two needed, which is an automated outcome based on a negative screen, so all no's. And you will get that immediately through our portal, and that is the end of the PASRR process. These are retrospectively QA'd to ensure the accuracy. A second outcome could be a provisional admission, which is another automated approval resulting from an indication of a PASRR condition, but also one of the exemptions to the level two for a time limited period. These are the previous categorical determinations, just the name is changed to provisional admission. This is your exempted hospital discharge. This is where the member is admitting to the nursing home directly relating to reasons for the hospitalization, or if there's a serious illness, a terminal illness, comatose state. There's a couple different exclusion criteria which we'll cover. So that would be an automated provisional admission if you indicated one of those options. And then finally, the third option outcome from a level one screen is an outcome that a level two is required. This is not an automated outcome, which means that a potential PASRR condition has been indicated and there is no provisional admission exemption applying at this point in time. The federal notice of proposed rulemaking has adjusted the previous term categorical determinations to the more accurate provisional admissions. These are time-sensitive exemptions to needing the level two evaluation. If the individual continues to reside in the nursing facility beyond the allotted window, then a new level one screen must be submitted, which will get reviewed and then trigger the level two evaluation process, as the provisional admission would no longer apply. So before we move on, let's quickly summarize some key takeaways from our training so far. It's important to know that data on outcomes through our qualatrack system is tracked, and all of our automated outcomes are reviewed consistently at a retroactive basis to determine quality. The questions raised by the level one screen are meant to raise critical thinking and elicit more information. Level one is not meant to be a one and done checklist item prior to a nursing home admission. Rather, this is an opportunity to evaluate the needs specific to a PASRR condition from an outside objective professional. A lot relies on how this form is initially filled out. So to us, good training and having support documentation available that supports the intention of this process is paramount. When in doubt, fill it out. Submitting a current H&P within the last 3 to 6 months, as recent as possible, is crucial to avoid potential requests for additional information that could delay the process. So we do have some minimum content that gets submitted with the level one, which we'll talk about. So now let's talk about the level one process steps, and then we'll get into the demo. So there are three stakeholder groups that would be completing a level one screen, and we're having trainings with all three groups here today. There's a single entry point for any individual where Medicaid is the primary payer. There's nursing home staff for individuals with either non-Medicaid funding looking to admit for the first time directly from the community, or for all resident reviews that'll be done by nursing staff. And the hospitals for all non-Medicaid funded individuals being referred directly to a nursing home from a hospital. All of these screens will be directly entered into the qualatrack portal, which we're going to demo shortly. Intelligence staff will manually review all level ones that have positive PASRR indicators and no provisional admission exemptions within 6 business hours, providing we have all the necessary documentation. Once we do request additional documentation from the submitter of the level one, that submitter will have 3 business days to send us the content. And then when we get that content back, our 6 business hour time frame resumes. Our goal is to be efficient as possible in providing the level one outcomes timely for the sake of all stakeholders involved. So to aid us in this goal, we ask that the relevant documentation be uploaded at the time of completing the level one screen. And I'll walk you through how to upload information today at the demo. This documentation, again, at a minimum, should include the most recent H&P history and physical from the last 6 months, a current medication list, and any other relevant clinical documentation to support any yes answers in the screen. And we'll cover those in a minute too, what those questions are. This is a graphic visual. I'm a graphic visual person, so I always appreciate having this as an option. So I've included it for people. This really shows those 3 outcomes and how they work through the system. So that first option at the top row is where we have a negative screen. So there's no level 2 needed. There's no indications of a known or suspected PASRR condition. The second blue box, light blue box of positive results can enter our last 2 outcomes. So that's where we get to now we have some positive results. There's an indicator of a PASRR condition. Now we have to look at our provisional admission reasons. These are our exemptions to the level 2 for a time limited period of either 14 or 30 days. If there are provisional admission indicators in that screen, those also will be automatically filtered out. You will get an automatic, immediate outcome from our 24/7 online system. Even if you submit that at 10 p.m. on a Sunday, you'll get an automated outcome says, yep, here was a provisional admission. Also, if there's no provisional admissions, that bottom tier of the flow chart as you see it is when we then do a manual review. And that manual review will be looking for to see if any of the automated steps were missed or if there was something in the way it was filled out. They'll check against the documentation uploaded and make sure that with the level 2 outcome needed, that is again done within the most timely possible. So takeaways here. The answers to the questions trigger that automated outcome. You receive an immediate outcome. Again, like I said, if it's Sunday night, 10 p.m., doesn't matter. You'll get an immediate outcome. If the answers to the questions will trigger a manual review, you'll be contacted through qualatrack. You'll get a notification email as the submitter to either present us with additional information or you'll be informed that you have your outcome within those 6 business hours. I also wanted to take a moment and highlight some questions that came out from our last 2 trainings when we think about our vendor transition timeline for completing the level 1. So there are 3 important dates that accompany this PASRR vendor transition: the 15th, 16th, the 24th, 25th, and March 1st. As you can see on this graphic, February 16th was the first day folks could submit known triggering level 1s or the PALs to Telegen via our email and secure send those to coloradoreviews@telegen.com. All other PALs should be submitted to the current vendor as normal. However, this Thursday, the 25th, is the first day that all level 1 forms should be submitted to Telegen via our email. And that'll happen through to our go live for our system. Please know there is an understanding with HCPF, CDPHE, the State Mental Health Authority, and the State Intellectual Disability Authority that Telegen will not begin processing any of the received PASRR content until March 1st. That's our contract start date. And any level 2 evaluations that would have been triggered between that 2/16 timeframe and 3/1 our go live have a 30-day extension. So starting 3/1, the qualatrack portal will open and all authorized officials that have completed those packets ahead of time will begin creating user accounts for the users in their system. And then those users may begin submitting level 1 screens directly through qualatrack. These level 1 screens will not be using the current form, so we won't be accepting those via email after 3/21. We'll be expecting the portal as the submission. So now I'm going to share just a few more slides before we get into the demo. I wanted to give you a slide that you will have in this slide deck later on, where you'll be able to see the PASRR questions that are in the system. These are the yes or no questions, and you'll understand how the manual review gets triggered. So I just wanted to share this with you, and we'll get into this in a moment in the system. But as we get into the demo, we will talk also about supporting documentation that will be available about this process, including screenshots of everything we're going to show you with the demo. So please don't be trying to get screen grabs as you're watching. We'll give you all of this later. Today, this demo is an opportunity to see the process through the system, to start to understand what it's going to look like, and know that the supplemental documentation you get will help you through this. So that said, I'm going to jump into the qualatrack system. And can you all see that I'm now sharing the qualatrack login screen?
Yes.
Okay, perfect. Thank you. Just wanted to make sure. I'm going to log in as a user. So I will see what you will see when you get your accounts to log in. So this will be your login account. Now I'm using the staging environment, which is a fake environment. So I'm going to be playing around with Donald Duck, Minnie Mouse. There's no actual PHI in this system, but it allows us to do demos. So This is that landing page where we showed you the screenshot of that last week. This is the qualatrack logo, which anytime you click on this, you will get right back to this page if you ever get lost. You have a member search button you can use up here or here. I'm going to go ahead and search to start a level 1 screen. So this is my option. I can either search by an ID number or date of birth, or first and last name and a date of birth. And I'm going to show you two options. One, we're going to look at Donald Duck, who is a person in our system because I've used him already for a training. So if I wanted to find him, there he is. I can click on any of these links and it'll bring me to his member hub. Now let's say I wanted to add in Pluto mouse, right? Mickey's dog. That's Pluto mouse. And I want to find him. I will get a member not found. What I would always encourage that we don't create duplicate accounts is really look for the members, see if you can find them. First, last name, those can be mixed up sometimes. So we would do mouse Pluto and see what we can find. But I'm going to go ahead and click add member. This defaults how I put it in there. So I'm going to capitalize that for the Mickey and Minnie's dog, Pluto mouse. I have Montana. I also work in Montana, so I've got that there. And then I'm going to go ahead and add this. I'm going to get this. We're going to put NA for social. I'm going to use, let's say, a Blue Cross Blue Shield ID number. And then I'm going to be able to, yep, we're going to keep that there. Address line 1, you'll notice anything with an asterisk, guys, is going to be required. So you're going to have to fill that out. And I'm going to say that they live on number 1 Disney Avenue. That's where they live. They live in Denver. Disney Avenue is in Denver, y'all. Oh, not Vermont, Colorado. And 80. That's what it'll look like. See this little kind of exclamation point? If I'm missing a required field, it will do that and tell me I've missed a required field. And I'm going to hit submit. What that does is that creates Pluto mouse, right? That creates my ability to add a member. And that brings me directly to their member hub. And you see, I still have all my navigation items up here, so I can still get around. What I'm going to do is add, and I'm going to add a request to the system for Pluto mouse. And it'll automatically pull through the date and time I'm making this request. So it will timestamp this for me. I'm going to pick PASRR level 1. You will notice that all of the other options for what Telligent does to support HCPUF are also listed here as well. For the purposes of our PASRR work together, PASRR level 1 is what you're going to pick. It will default to say nursing facility, long-term care. You don't have to worry about those fields. Those are just for our system to help navigate your request to the right audience. You do not have to add anything. Those will auto-populate. You will have to choose a timing. So the way this works, this is our version of the pre-post for how you guys are currently doing level 1s. If the member has not yet admitted to the nursing facility, you're going to pick prospective. It hasn't happened yet. If the member is currently in your facility, then this is a concurrent because it's concurrent to the fact that they're already admitted. So that is your pre-post admission. So I'm going to hit pre. And in my example, we're having a member who's at Denver Health and Patient Psych who's being referred to Uptown Care Center. So that's the situation we're going to play with today. So I'm going to say this admission date field, these are panels. I call these panels in qualatrack, anything with a green heading, like all these little panels. So when you're at your request, your summary of the request, you'll see a bunch of different panels, and we're going to go through these and let you know how these all work. You also, again, have the ability to get back to the logo. This breadcrumb is interactive and clickable. So if you click it, you'll get to it. If you scroll over the member's date of birth, you get their age, which is nice for me. Admission date, I'm going to put the projected anticipated admission date to the nursing facility. So I'm going to put my projected date. If you already have an admission because you're doing a concurrent timing, you will put the date they admitted to the nursing facility. Admission type is a required field. Admission source is not, so you do not need to add that information. Again, note those red asterisks. Coverage, if the member does have Medicaid, Colorado Medicaid, and we're loading them in on a daily file, you will see information here. If the member was created by you or the member is not found on that admission file, you will see it blank here. This is a required field, so please just put NA to help you move on from that. Now we get to providers. So this is a wonderful thing that when we did this training about an hour and a half ago, people had a lot of questions. So I want to assure you that we will provide additional supportive documentation. And this is just a good, quick, high-level demo so you can see how the process works. But the details of these 3 fields, you'll have additional documentation to refer to. So treating physician is going to be our Denver Health physician that is working with this member. I click add, and then I can click an NPI number for an individual. I'm just going to pretend that we're using Dr. Nussbaum here. He works at Denver Health and Patient Psych. I'm going to borrow him for purposes of this training. I hope he doesn't mind. And then treating facility is going to be, where are they going? You can think about treating facility as admitting facility. Admitting facility. The language here is just treating facility, but all of our support documentation will call that a one-to-one match with treating facility. So I'm going to go ahead and click add, and this is going to be Uptown because that's where they're going. Uptown's going to be the one treating them for the nursing care that they are being referred for. Yeah, it didn't copyright. It didn't do that last time either. Copy, paste. There we go. So there's my Uptown Care Center. When you find the one you want, you're going to hit the plus sign. Now, case management agencies might not necessarily have an MPI number. So they should have a Medicaid ID number, however. That you can search in this other ID field, right? For a Medicaid ID number, Medicare ID number, or other number right there. So you can do either one, MPI or other ID number. And then when you found the one you want, you're going to hit the green plus sign to add it to the case. And now I've got a specific provider. I've got a specific place where they're going. Even if this is not exactly where they're going to go, but this is just the anticipated, you have to put something. You have the ability to put multiple. So you may have 3 nursing facilities that are being targeted for this admission. They can put all 3 in, and then when they go back, they can just delete, and I'll show you what that looks like. And now ordering provider. This can be, I can copy from the physician to say, look, it's the same. Whoever's treating him right now is the one who's ordering this. Or I can make it different. And I can say, yes, I want to delete that. And I want to change my ordering provider to be somebody brand new. Like maybe I want to do all of Denver Health. I can do that too. So just to show you how it works, I'm adding 3 different ones. They can all be the same. If it's the nursing facility and you're doing a resident review, all 3 of these might be the same, and that's perfectly fine. You just will have to have 1 in each, but it can be the same thing in all. And then again, additional providers, you can have up to 5 more additional providers in addition to the mandatory 3. Now, again, I'm using a staging system, so this section is not available to me in staging, but in our live system, anything you have added to your provider panel, you have the ability to give visibility to that anyone at that agency. Any user associated with these agencies would be able to see this PASRR request in the member hub if I've given them visibility. Adding them as a provider alone does not give visibility, and you can't give visibility to anyone you haven't added as a provider. So step 1, add them as a provider. Step 2, give them visibility. It's a nice and easy process. It's just a quick drop down. We'll have screenshots of that. Diagnosis. Then you're going to add a diagnosis. And there is a search here. You can search by code or by term, however you have the information. Only 1 diagnosis is required. You can add as many as are appropriate that you want to add in, but at least 1 is required. Procedure code automatically populates for you with PASRR information, so you can skip that panel. Then we get to the actual level 1 screen, right? Which is what we're all here to talk about. So this level 1, oh, didn't pop up in here. Hold on 1 second. Let me go back. I'm going to pull it up somewhere else. Sorry about that. I'm going to show you the one that we did earlier today. I'm doing 3 of these today, and I want to make sure I can get the same content for all 3. So I'm going to do Minnie Mouse. I know we've done some for Minnie Mouse. Actually, this will be good because then I can show you what it looks like when we go in. So here's Minnie Mouse. So again, if you found a member, here's what happens rather than creating a member. I get brought straight to their member hub, and I can see that we've already been playing around with PASRRs for Minnie Mouse. She already has some, and those requests are complete. So I'm able to go in and view them even after they're complete. So what happens when they're complete, when you come in, you then get the ability to, again, mess with these providers. So if Uptown's no longer where we're going, I can delete that. Even though my request has been submitted, people have been reviewing it, the level 2 might be in progress, I can still come in here and edit and keep that going. And then I can also edit my visibility to add and remove visibility for people as needed. So then this is where you see, again, the assessment panel is going to have a copy of the PASRR level 1 itself. So I'm going to try to go to her member hub and add a new one. So that we can see it in here. And I want to jump down to, yep, okay, so here's what the questions look like when you see them for the first time. You'll have a section of A for mental illness. There's 3 questions, yes or no. You'll have a section B for intellectual developmental disabilities or related conditions with 4 questions, all yes or no. And that will be it when you first get there. If these are all no, your PASRR process is over. And then you just add your documentation and you continue and you close, you get your automated outcome, you're done. If any of these 7 questions are yes, and you put in a comment of additional information, whatever that may be. Sorry, I can't type while I'm presenting. Schizophrenia. Symptoms are present. Then you have the ability to get a section C for provisional admissions. If you do not have a potential known or suspected PASRR condition, you will not need to get a provisional admission. So that section will not appear for you unless you have at least one indicated yes. And then under the answers here, this is where if I answered yes to any of these, I'd have to add a little bit more information. And I would expect to see some additional documentation uploaded that supports that yes. That's what we would be looking for when we go to QA these as well. And so then we have documentation that we'd be adding. To add documentation, we do have a drag and drop process where I've already got saved over here kind of a blank document. I'm going to drag and drop it, and then it's going to come up. There you go, blank med list, category. It's a clinical document, and it's a medication history, and I upload, and there it is. Then if I add my H&P, I'm going to add my H&P, clinical, and my topic there is medical treatment history, upload. You can upload as many documents as you need to, but you have to document at least one. So let me finish this. And there we go. I'm going to hit continue. Oh, yeah, I didn't fill out everything in here because I was jumping around between 2 people. So it will always give you this. This is really nice. It lets you know when you've missed information. It will give you these little red boxes. And I'm going to show you how you can do this where you just do it all as the same. Let's say it was all Uptown. Copy, paste. Okay, hold on, let me get that. Come on. Why are we not finding it now? Okay, so let me do a different one. Hold on. Okay, I'll do this first. There we go. So we'll just put him back in, and then I can copy. I can add my Uptown. Now let's add that here. Thank you. There we go. More back in, and this one I'm just going to copy. Okay, and my diagnosis, let me add that in here too. Add that in, submit. And then I've got all that filled out. All right, so now I'm going to hit continue. I didn't put any comments. See, again, it will tell you, which is really nice. Continue. Please put actual comments. I'm just doing this for the purposes of the demo. But those are great text fields. We're hoping for more information from you to help explain any yes answers. And then when you hit continue, again, this is our staging environment, so I promise you will not see this additional step. I'm just moving through this now to try to make sure that we can see the rest of the process in our system. Let me skip ahead here. The last thing that you will see when you're submitting a level 1 screen is you will see this attestation. This is where you can add your username that you've been given to help make sure that you are attesting to this information. So I'm going to add my username that I am using here and hit submit. Then you get this last comment box. And what I highly recommend for this last comment box before submitting a level 1 screen, especially if you know this is going to be a triggering level 2, is to add a good contact person. So I'm going to say best contact is Sue Storm, who is a social worker at Denver Health. And I'm going to put her phone number, best number is 303-123-4567. So that way, when we go to reach out for either additional information or to schedule that level 2, we have a good contact person to reach. So please use that spot for that. And then you see what you've done. You're able to see everything that's in here. And so I'm going to go ahead and go to Member Hub and show you what it looks like there. So now, again, request has been submitted. So this is the one that we just added. Request has been submitted. These were the ones we were previously playing with on other trainings. So that's what it looks like when it's complete. And again, I still have the ability to either delete it completely or to view my request before somebody on the intelligence side has touched it. Case ID is a unique number that the case gets in our qualatrack system. And you see again, I have the ability to edit this. And if I edit, I get the ability to change up my providers. So it opens everything back up to me and I can change everything. Okay. And then it'll bring me back to this if it hasn't been viewed yet by anybody. Okay. Submit that. And then lastly, I want to show you guys what it looks like to see the outcome letters. So I'm going to pick a different request for Minnie that we've already done to show you what those letters look like.
Is there any way you could slow down?
I know I'm trying to cover everything.
I mean, or like, can you look at the chat box? Because there's a ton of questions.
Okay, there's 33 questions and we have about 15 minutes to go. So I'm going to show the outcome letters for folks just so that they have that, and then we'll jump over to the chat and we'll go through as many questions as possible. And your outcome letters, you'll be able to see those down here. Correspondence panel is where you'll be able to see any letters that have been attached. This example has the level 2 notice of determination. And then we also have some examples in the member hub where we can see the level 1 outcome letters. And I want to show that to people too. I'm going to go in and view this request. And here we go with the level 1 outcome letters. So this level 1 outcome letter will have the determination of a level 2 is needed, and then you'll see some additional information. This is meant to go to the member, and we'll have examples of all of what these different outcomes will mean. So there's language in the outcome letter that explains the different outcomes. Copies of these letters will also be available to people along with the supporting documentation of screenshots and step-by-step for everything that I covered today. Again, I just wanted to try to give people a visual of the system and what the process looks like. We will do supportive documentation for folks that really walks it through, for folks to be able to walk through it themselves at a slower pace once the system goes live. So that being said, I'm going to jump back to the PowerPoint and go through some questions as we go through. So again, like I just mentioned, we will have step-by-step handouts, summary cheat sheets. This training is going to be recorded and available, and staff support resources by Telligent. HICPUF, the State Mental Health Authority, and the State Intellectual Disability Authority will all be available. There are slides in the slide deck for the level 2 overview. I encourage folks to be able to reference that as well. Since we didn't cover the level 2 during this training, we just stayed specific to the level 1, but there is good content in here that I would recommend folks take a look at as well. So just wanted to highlight that. So let me go to the chat feature. We will get through some questions. Okay, I'm going to jump up to the top and go through these. So where can we find slides recording previous training sessions? I can jump to that website to show folks how to get there. I think that would be helpful. I always just Google for Colorado PASRR because I don't have it bookmarked yet. Colorado PASRR, you're going to get to this page, which is the Colorado HICPUF page for pre-admission screening and resident review. There's a training button right here. All of our previous trainings, as well as this training, will be located here. Here's our introduction training. The slide deck is the top link. The Q&A document is the second. And then a playlist of all of the recordings are here. Again, part 1, our training last week, the slide deck, Q&A summary, and recordings. This will be available for today's training as well. As they're available, they will be posted here. So this is the website. You can also, I'll put it in the chat. You can also just Google Colorado PASRR and you will find it for folks. Okay, let me scroll back up. So everything is available. Oh, looks like it was already been added as there too. Training tab. Yep. Link to the website where the qualatrack portal. OB added the qualatrack portal as well as all the help desk information to our chat as well, and some good information. Thank you, OB. I'm going to scroll through that. We've got some people's names in here. People were talking about audio. It looks like everyone can hear. That was good. Someone couldn't hear it. It was on the phone. Sorry, I'm scrolling through the chat questions. We have completed the registration. When can we expect to hear back with login information? Great question. This week. The reason why the emails did not go out until this week is because the link in the email to start the process for getting accounts in the system would only be valid for 7 days. And our system is not live until March 1st. So those emails weren't going to go out until this week. So please expect that email this week if you're an authorized official. Next up, what would we use for a member ID number if they don't have Medicaid? You could use a social security number in lieu of a member ID number. You could also use a 9-digit ID number that is from a different health insurance provider. Really, it's a unique identifier for the member. So if they don't have a Medicaid ID, any other 9-digit number would work. And I scrolled a little bit too quickly there. Let me go back. Will we need to know the MPI number of the admitting facility? Yes. So the nursing facilities should all have an MPI number, and that is in our system. You can search by name. However, it's always faster to search by MPI number in the system, but you can use our system with a search for a name. Our hospital is also being trained on this system. Yes, we just did that this morning. We did the same training for hospital staff this morning. Exact same training, same slide deck, same PowerPoint we went through, and same supporting documentation. We're doing it for the case management agencies and single point entry later this afternoon. Can we go through this slower? I know it's a lot of information, and the goal today wasn't for you to memorize what we showed you. The goal is to pique your interest and get you exposed so that you can then follow up on the documentation and support resources we provide you. You can have in-services with your teams. You can talk to your coworkers. Use our recordings as again, opportunity to revisit the content later. Today is not about memorizing the process. That we did not have enough time for that today. Also, what if there is no diagnosis? You're able to use a medical diagnosis in the system as well, so there should always be a primary diagnosis to enter. What if they do not have a mental health? Yep, so you can use a medical diagnosis as well. Confused as to where to register. So that website that OB included for the senior long-term care services, that's where the qualatrack portal will live. Telligent is using qualatrack on several different tasks to support the activities of HICPUF. So the portal for qualatrack is not, since it's not specific to PASRR, the qualatrack portal doesn't live on PASRR. Rather, our PASRR trainings do. So please visit that other website that Obi put in the beginning of the chat to begin the registration process. And that's where the actual portal will live as well. Hospitals will return to completing level 1s prior to someone admitting to a nursing home, correct? Yes. The intention of PASRR is that the entire PASRR process is completed pre-admission to a nursing facility. That is going to resume in April, and those dates have been published for people as well. That is the current anticipated date of the end of the 1135 waiver for PASRR. Do all level 1s need to be resubmitted through Telegen? No. So I will go back to those dates and the slide deck that we shared for also information about not having to resubmit. So it's only the ones from February 16th through March 1st that triggered a level 2 that we would need to have, or anything from February 25th on. Otherwise, the current process works for PALs through the 24th. I know, I apologize for jumping around a little bit on the screen. I was trying to be able to show people information. I encourage you to view the slide deck again at your own pace. We switched from Pluto Mouse to another member because I was trying to show different parts of the system. You guys be able to send written instructions? Yes, there will be step-by-step screenshots of the process so that, again, you can follow at your own pace. I wanted to try to be able to give a whole presentation in an hour. Handouts will be helpful. You will get those. Could you send out the link for all the recordings? PTAC website, or not the Colorado website, not PTAC. We'll have everything for you. This is the one time we're offering this training. But again, the recording will be there. You can slow down the recording, stop it, watch it again, dissect it with people. Hopefully, again, this is just the beginning for you of your journey to learn our system. Yes, you could use the Medicare number. Someone asked if you could use the Medicare number. Do rehab facilities have to submit PASRRs? This is for any nursing facility licensed to accept Medicaid. So I think it will depend on your rehab facility. I would encourage you to follow up with OB about that if your facility is on the list. Can we get the website link where we can get all the information? That's the website I just took us to, as well as it's in the chat. New administrator, how can she access Telegen? All accounts will be created through that provider executive authorized official process we covered last week. And that training, that slide deck is available if you weren't able to attend this training last week. So please know you can go there. How many days after admission do we need to complete a level 2? I'm going to go back. Again, the purpose of PASRR is to try to get them pre-admission, but obviously that doesn't always happen, especially with the 1135 waiver. So what we're trying to do at Telegen side, we're trying to do the entire process from level 1 screen being submitted through to publishing a notice of determination letter within 5 to 7 business days. So we're going to be partnering with the facilities where members are located to try to get those level 2 evaluations done when they are triggered as quickly as possible. We've done same day appointments before. We'll do next day appointments, really trying to make that balance of efficiency happen. As the PASRR form can be printed, yes, our PASRR forms can all be printed. The level 1 can be printed. The level 2 form can be printed. There's a little print button on the top when you're viewing it. And all of the outcome letters are printable as well. We do know those need to be in the chart, so we have that. Can liaisons do the PASRR only hospital staff? I'm not sure about a liaison specifically, but PASRR, any hospital staff or nursing home staff or community case management staff will have access to qualatrack. When trying to register our provider executor and the author. Samantha Bell, unfortunately, I can't read your question. I'm going to see if maybe it's in here again. Link to register for qualatrack. That's the senior long-term care link that's been shared in this chat. 3Ds to remember. Yes, I can. That's a great question. So when thinking about, again, that difference between a PASRR condition and a diagnosis, we're looking for the duration, the deficits or the level of distress that that diagnosis is causing, and also knowing the dementia exclusion. That's in this slide deck. Great helpful hint from PTAC. Who is Telligent contracting with to complete the level 2 PASRRs? We have a combination of Telligent employees that are skilled assessors, and we also have contractors in the community of Colorado. So we have a very wide portfolio of people to do the level 2. I'll go over the timing one more time. So the timing for our system, if it's a prospective, if the member has yet to admit to the intended nursing facility that would be required to do PASRR, that's going to be a prospective level 1 submission in our system. If the member is already in the nursing facility, then that is going to be a concurrent timing. Hopefully that distinction helps when we think of pre and post admission. Oh, there, Samantha, you repeated it. When trying to register provider, executor, authorized user, it stated email invalid. All information was correct. So how do I know this setup, this could go? Stephanie Wilson, I know, is one of our folks at Telligent that's helping navigate people through that process. So I'm going to go ahead and include her email because I think it's been sent to people before, swilson@telligent.com. If you have, and I'll put mine in here too, if you have any issues getting registered with the qualatrack as a provider executive authorized official, please let us know as soon as possible. We don't want any delays in getting accounts created. So I'm going to add my contact info as well. And then, okay, I think we only got a few more left. And we've got 4 minutes, so I think we're going to do it. Functioning for printing the level 1, we've entered yes, there is a print function on all of our forms, so you're able to print that. We need to have in-person visits. Yep, so we have the ability to do in-person visits as well as telehealth. Under the waiver, what date will level 1s be required? April 24th, I believe, is that cutoff date for when we start the 1135 waiver is targeted to end and the pre-admission will begin again. Our level 2 is going to be done remotely versus in person. We have the capability to do both. So we'll be doing telehealth and in-person assessments. And then we've got just a few more questions here. Is there an alert system for the portal? Yes. So as the submitter, I got emails while we were talking, which I probably could have showed that I got emails saying your request has been submitted when I hit the submit button. And then after an assessment's been reviewed or after a request has been reviewed, I got another email notification saying you have an outcome available in the portal. So the individual user that sent the submission through qualatrack will get automatic email notifications when there's an update. Or saying that your submission has been received. The forms that are used, we don't have any forms. We just have our screens in the system. So there's no forms you need to upload other than your own supporting documentation. To clarify, the Colorado PAL and PASRR does not need to be completed on the form. Yes, you do not need to do any forms. Just use the qualatrack portal. Answer those yes or no questions and you're done. So that's what we're moving to that system, hopefully to be a lot more user-friendly and efficient. Then OB added, please let me know if you're not currently on the PASRR email list. OB does send out regular information. And then somebody else asked, what about meds? And I do want to say that we do require a med list to be submitted with that level 1 screen. And there is one of those yes or no questions that asks about current medications and if there's any psychiatric medications that have been prescribed. And yes, you have to submit an H&P even if there are all no's, because what we do is we're going to retrospectively QA that to make sure that the system was working appropriately. So we'd want to be able to look at that H&P and say, if you selected no for everything, we need to be able to verify that that was an accurate submission, that those no's were in fact accurate. So that possible QA needs to be able to be done. So please submit an H&P and a med list at a minimum on every level 1 screen submitted. And how do you upload? So I did walk through that documentation upload, and I will encourage you to look back at the training video for that on that section. Okay. I think we are all set. We have only 1 minute to go. Any questions that we didn't get a chance to answer will be part of our summary Q&A document like we did for our previous trainings. And so with that, Obi, I think I'll hand it over to you for a final closing statement for our training today and any other information you want to share.
Thanks, Jean, and thanks to everyone for participating. And I see a lot of comment here expressing that it was going a little fast, and we totally understand. But what I want to say, I'm going to discuss with Jean and some of our teammates. We might be able to do a full level 2 training, but again, I just want you to know that that might be coming. But we'll discuss, with our team, and we'll get back to you on the plans regarding that level 2, because the intelligence system is different from what we've had in the past. The NOD that you're going to be getting is going to be different from the NOD you've seen in the past 4 years or so. So we want to make sure that we equip you very well with information that you need to be able to find the level 2 document useful, for your and for the benefit of our members also. So I just want to say thanks everyone, and thanks Jean for a great job today.
Whew! Yes. Thank you everybody for attending and sticking with us. Again, we will get documentation out there to support this process for you. You will not be alone.
Oh, by the way, please, seriously, send me, if you're not in my email list, I really need to get your email address, because we're going to be sending out a lot of information, okay? So we really need to make sure you're getting all the information that we're sharing, especially as we're getting into the effective date of March 1st, okay?
I see a lot of
and
people
my email
adding
address
their
is posted on the chat.
Yeah, I see a lot of people adding their names, so I think we'll be good here too. I'm going to go ahead and stop the recording and end the meeting. I know there's probably other things people have to get to today, but I really appreciate your time. And thank you again for sticking with us, and we will be in touch soon. You will have more information as we move forward. Thank you very much, everybody.
Thanks all.
Bye.